Hi and welcome. This video is meant for those who have given birth to their first child and already had a doctor's checkup in maternity clinic. In this video, you will get information about pelvic floor muscles, diastasis recti, how to massage a possible C-section scar, how to start exercising after childbirth, and about the child's motor development. Pregnancy affects the pelvic floor muscles. These effects result from changes in the body's center of gravity and hormonal changes. The pelvic floor muscles serve as the base of the abdominal cavity, supporting and carrying the organs in the abdominal and pelvic areas, such as the bladder, uterus, vagina, and rectum. Recovery of the pelvic floor muscles can take up to 6 months after childbirth. The abdominal muscles work together with the pelvic floor muscles to connect the ribcage, pelvis, and back muscles into a functional unit. The abdominal and pelvic floor muscles play a part in force transmission, spinal posture control, reduction of spinal load, regulation of intra-abdominal pressure, and movement production. The functional activation of the deep core muscles in conjunction with the pelvic floor muscles is emphasized in the prevention of back pain and dysfunction. Weak activation of these muscles is associated with the back pain. Here you can see the deep core muscles. Multifidus are the deep muscles of the back, transversus abdominis, which is a deep muscle of abdominal area, pelvic floor muscles, and the diaphragm. The pelvic outlet is formed by the pubic symphysis, sitting bones, and the tailbone. A healthy pelvic floor is essential for balanced functioning of the whole body. It is strong and elastic like a trampoline. Strong and elastic pelvic floor is needed for functions such as urinary and fecal continence, sexual functions, childbirth, effective breathing, and as a part of supporting the back. In this picture, you can see a woman's pelvic floor muscles viewed from below. The musculature of the pelvic floor consists of 2 layers, deep and superficial. Dysfunctions of the pelvic floor muscles are common, and the risk is increased by factors such as pregnancy, childbirth, inactivity, overweight, and aging. Dysfunctions include functional and structural disorders related to urination and defecation, as well as gynecological prolapses. Urinary incontinence is the most common symptom of dysfunction. During pregnancy and vaginal delivery, soft tissue structures are stretched. The stretching, as well as perineal tears that may occur in different degrees during childbirth, increase the risk of dysfunction. Pelvic floor pain is usually felt deep in the rectum and in the pelvic floor area. It may cause muscle spasms, for which initial treatment includes heat and relaxation exercises. Gynecological prolapses are changes that bulge into and out of the birth canal. They are also known as vaginal hernias. In gynecological prolapses, the uterus, front or back wall of the vagina, bladder, or rectum can protrude, for example, through the vaginal opening. The prolapse is caused by the weakening of the pelvic floor's supporting structures. Symptoms of prolapse may include a feeling of pressure in the pelvic floor and difficulties with urinating or defecating. Mild symptoms caused by a prolapse can be treated, for example, with pelvic floor muscle exercises. More severe symptoms are corrected surgically. In this first picture, you can see a weak pelvic floor. The line marking pelvic floor muscles is saggy, organs are not supported well, and lumbar curvature is increased. In the second picture, the line marking pelvic floor muscles is strong and healthy. Organs and spinal posture are well supported by that. The goal of training the pelvic floor muscles is to maintain urinary continence, restore it, and good sexual functioning. You can start pelvic floor training immediately after childbirth, just like deep abdominal muscle training. Training begins in positions where the muscles are easy to feel, for example, lying on the side, sitting, squatting. Further on, the goal is to achieve more functional starting positions such as standing. Being motivated and active is important. Pre-activation and training in connection with everyday activities like lifting the baby, walking, cleaning, sneezing, and coughing. In cases of pelvic floor dysfunction, the training should be long-term. It should happen 1 to 2 times a day, 5 times a week, and for several months. The first results are usually noticeable in 6 to 8 weeks. Everyone can take action to improve and maintain the strength of their pelvic floor muscles. Making effort to prevent dysfunctions should be a lifelong venture, regardless of age. Next, we will go through on how to try pelvic floor contractions. Take a comfortable position and close your eyes if you want to. Think about where your rectum, vaginal opening, and urethra are located. Imagine a zipper that you zip up from the back to the front, starting from your rectum over the vaginal opening and urethra. When you contract, it should feel like you're pulling and lifting your vagina towards your belly button. When you get the idea of that, you can test the contraction strength of your pelvic floor muscles yourself with the finger test. First, wash your hands and put some lubricant, for example cooking oil, on the index and middle fingers of one hand. Gently insert both fingers into the vagina about 3 to 5 centimeters deep. Relax for a moment. Squeeze your fingers with your vagina and then let go and relax. Take the fingers out and wash your hands. With the following tasks, you can evaluate the controllability and strain tolerance of the pelvic floor and the abdominal wall. These tasks should be performed without pain, a feeling of pressure, or urinary and fecal leakage. Walking for 30 minutes, standing on one leg for 10 seconds, jogging in place for 1 minute, jumping 10 times, jumping on one leg, 10 repetitions on each leg, mini squats on one leg, 10 repetitions on each leg. And later on, when you feel a need to urinate, perform jumping jacks and cough for 1 minute. If there is no leakage, the pelvic floor muscles are in good condition. While the pelvic floor needs to be trained, relaxation must also be practiced. Having an overly tense pelvic floor is a common problem, and tense muscles are not equivalent to strong muscles. It is important to know how to relax the pelvic floor muscles. The pelvic floor is a system by itself. Muscles need to be strengthened, but not excessively. Overly tense muscles can lead to problems such as pelvic, buttock, and lower back pain, urination and defecation problems like dribbling, increased needs to urinate, and constipation, pain during intercourse, and even teeth grinding. In these poses, you can see different ways where you can try relaxation of pelvic floor muscles. When training pelvic floor muscles, you can do different types of contractions. Explosive strength is needed when sneezing and laughing. Endurance strength is needed for activities like walking. And maximum strength is needed for exertions and lifts. Traditional abdominal crunches can be started when the pelvic floor muscles and the membrane between the abdominal muscles, linea alba, have recovered. If you have challenges with identifying and distinguishing the pelvic floor muscles, many private physiotherapists who specialize in these muscles have biofeedback devices to test muscle condition and activation. In this table, you can see basic strength exercises for the pelvic floor muscles. There are 4 different kinds of exercises for awareness, maximum strength, endurance strength, and speed strength. On the left side panel is noted the length of contraction, strength of contraction, rest between contractions, how many repetitions you should do, and training frequency. Training the pelvic floor muscles should be integrated into everyday activities and chores. It would be important to contract the pelvic floor, for example, when lifting, climbing stairs, getting up from a bed or a chair. Pelvic floor training can include strengthening the pelvic floor and the connected muscles, treating muscle tightness, improving proprioception, breathing exercises, increasing awareness of the pelvic floor and pelvic region, as well as developing the collaboration balance, coordination, and posture control among different muscles. Diastasis recti, meaning the separation of the abdominal muscles, is a natural occurrence during pregnancy. Its prevalence is 100% in the last trimester. The cause of the separation is not certain. nor is the scientific evidence on how to prevent it. Spontaneous recovery of the abdominal muscles is known to occur during the first year after childbirth. The recovery is fastest during the first 2 months after childbirth. It is recommended to test the separation of abdominal muscles 2 to 3 months after childbirth and as necessary. The test movements should be performed like this. Lie on your back with bent knees and the soles of your feet on the floor. Perform a light elevation of the head and shoulder blades while your hands are reaching towards the feet. Palpate the membrane between abdominal muscles, the linea alba, with your fingers from the lower part of the sternum to the pubic symphysis. Observe these things while doing the test movement. Does the abdomen bulge longitudinally from the midline? Do you feel the edges of the abdominal wall and the straight abdominal muscles moving towards each other? Or does a gap remain? Is the linea alba firm or is it soft under pressure? A reference value can be considered to be around approximately 3 centimeters or around 2 fingers width. Especially the firmness of the linea alba and the functioning of the torso are important. During the first 2 to 3 months after childbirth, it's good to give the body a chance to rest and recover. During this time, it is advisable to focus on training the pelvic floor muscles and the deep abdominal muscles. After 8 to 16 weeks after childbirth, the following symptoms are abnormal and may be connected to separation of the abdominal muscles. Constant pain in the back, pelvis, groin, and abdomen. Problems retaining urine, feces, or gas, for example when sneezing, laughing, or lifting heavy objects. Leakage of urine or feces, a feeling of pressure or bulging in the vagina or around the anus. A ridge in the abdomen along the linea alba during any exercise and, for example, when getting out of bed. Experiencing difficulties in daily life due to the mentioned symptoms. If separation of abdominal muscles occurs, you should avoid movements where abdominal pressure is applied to the abdominal wall muscles and their interconnecting tendency, such as planks and its variations, jackknife exercises, scissor exercises with the legs, crunches for the rectus, the straight and oblique abdominal muscles, heavy lifting and straining that increases intra-abdominal pressure, like weightlifting, and holding breath while exerting, rising directly to a sitting position, including getting up from bed. Learn to get up by turning onto your side first. A C-section scar results from the healing process of a cesarean section wound. Scar tissue is part of the skin's natural healing process. Scars can tighten and form adhesion, which affects physical functioning. In such cases, scars can limit body mobility, potentially causing pain and malpositions. It is advisable to treat a C-section scar and aim to prevent the formation of adhesions between tissues and the potential problems they cause. Furthermore, taking care of the scar can help prevent excessive growth of the scar tissue. You can take care of your C-section scar by massaging it with the following instructions. Make sure you have clean hands when massaging the scar area. The massage you perform should be gentle and painless. A reddened, swollen, hot, and inflamed area should not be massaged in any situation. The scar itself may be reddened, but the surrounding area should not be. The scar to be massaged should be completely closed up and clean. Start gently from the skin around the scar, about 10 centimeters away from the scar, and then move closer to the scar. Feel the scar by gently touching it with your fingers. Gently move the skin with the wide grip using the 3 middlemost fingers. Repeat the back and forth movements as well as zigzags and rotating movements in both directions 5 to 7 times. Touching the scar may still feel uncomfortable, but that is not dangerous. Massage can be done in connection with daily showers. Later, you can do the massage in sauna where the heat enhances the treatment. Exercise after pregnancy and giving birth is allowed and recommended. Exercise should feel good and should not cause pain, a feeling of pressure, urinary incontinence. And if these symptoms occur, don't stop exercising entirely. Instead, do adjustments to make exercise more suitable for yourself. The most important thing at first is to go outside, refreshing oneself in the fresh air, getting to know other parents, which makes exercising and chatting together enjoyable, while also providing peer support. You should start exercising gently without straining the pelvic floor. For example, you can go walking, do outdoor activities, yoga, Pilates, mother-child exercise classes, dancing, skiing, and cycling. Exercise is increased as the fitness improves. One should listen to themselves with the aim of returning to previous levels of fitness and exercise habits. Water exercise is suitable after postpartum bleeding has stopped. Breastfeeding is not an obstacle. When walking, aim for painless, evenly paced steps. Make time for walking without the stroller too. Allowing your neck and shoulders to relax and your arms to swing naturally, which introduces a normal rotational movement to your back. Nordic walking is a great form of exercise. Pay attention to your shoes. Walking should be comfortable and your shoe size may have changed. Pay attention to your posture. The upper back can easily round due to carrying and breastfeeding and the weight of the breasts. The pelvis can easily tilt forward. Wear a good bra to support your breasts, with shoulder extensions if necessary. If running is something you are looking forward to, based on current research, running is recommended no earlier than 3 to 6 months after childbirth, when the pelvic floor has recovered and there is no pain, a feeling of pressure, or urinary and fecal leakage. Listen to your own body during the recovery process. Vigorous sports that involve a lot of jumping and exertion like aerobics, ball games and running can slow down recovery and stretch a weak pelvic floor even further. Prioritize getting your pelvic floor muscles in shape first. In this picture is the physical activity recommendation for 18 to 64-year-olds. It introduces the amount and type of physical activity beneficial for health of working-age adults. Next, we will go through some exercises. Lie on your back with bent knees and the soles of your feet on the floor. Aim for neutral position for the spine. Exhale and gently tighten your lower abdomen inward. Hold the tension for about 10 counts. Relax and repeat 10 times. You can do this exercise sitting or standing. Lie on your back with bent knees and the soles of your feet on the floor. Aim for a neutral spine position. Exhale and reach one hand towards the ceiling while simultaneously slightly drawing your lower abdomen inward. As you inhale, bring your hand back to the level of the other hand. Repeat 10 times. Lie on your side with your back and pelvis in neutral position. Knees and hips are bent. Press lightly with your top hand against the surface. Keep your heels together. As you exhale, lift your top knee without letting your back or pelvis twist backward. As you inhale, return your leg to the starting position. Repeat at least 10 times. Do the same on the other side. Tight quadricep muscles can potentially alter the position of the pelvis and cause strain on the lower back. On this stretch, lie on your side and place your lower leg in front of you, bent at the knee. Grab your top leg at the ankle. Lightly squeeze your buttocks together and move your leg backward. Hold the stretch for 30 seconds. Repeat 2 times. Do the same on the other side. Sit on a chair with your back straight. Keep your hands crossed on your chest. Gently pull your lower abdomen inward. Bend from the hips, keeping your back straight, and perform small, quick rotational movements with your upper body. Repeat 30 to 40 times. Next, we will move on to a child's motor development. Movement is important for a child's physical, psychological, and social development. Through movement, a child becomes familiar with their own body and their environment. They derive joy and satisfaction from learning new things and achieving things through movement, like reaching their mother or a desired object. Learning diverse movement patterns and using both sides of the body will prepare the child for future learning, for example, reading and writing. A baby will develop motor skills without any special exercises. However, providing daily repetitions of posture and movement pattern supports and promotes motor skills and activates the child. If motor skills are slow to develop, exercises and repetition of movement patterns can facilitate motor development. In terms of time, this can be done for just a brief moment, leaving a memory trace for a few seconds to a minute. Repetition is more important. The development of movement progresses in stages from easier abilities to more demanding ones, based on the capabilities provided by the developing nervous system. Each child is an individual, and development does not always progress in the order described by the literature. Typical sensory motor development has a wide range of variation. Because of that, it is not beneficial to compare one child to another. Appropriate muscle tone is important for sensory motor development. If muscle tone is very low or high, it can slow down motor development. Let the child spend plenty of time on their belly, side lying, and on their back so that they can practice their developing abilities. Over 6-month-old children enjoy movement like turning from back to belly, leaning on their hands, rolling and changing positions. They are rarely satisfied when staying still on their back if they have the option to move. The child's motor skills progress from head to toe and from the center of the body across the limbs. Handling and holding a baby in many different ways helps to develop the baby's muscle tone and body awareness. In order to support this development, it is important to rehearse different positions and movements with the baby every day. Here, repetition is more important than duration. All kinds of sensory activities also promote motor development. For their motor skills to develop, a baby needs to be aware of their body. Therefore, a baby needs all kinds of sensory stimulation, such as massaging, stroking, and feeling water on their skin. Initially, a baby's head needs a lot of support, but muscles develop rapidly, and in no time, the baby will be able to hold their head up on their own. Always support the baby's head by holding the back of the head rather than the neck. While supporting the head, try to confirm the baby's muscle movements, as supporting the head too rigidly can slow down the development of head support. Picking up a baby with one side up will strengthen their neck and shoulder muscles and encourage them to turn on their side. If you pick up a baby with one side up, you do not need to support their head, as even a newborn can hold their head up in this position. You should always put the baby on their side before lifting them or putting them down. You should alternate the side when picking up and putting down the child. Put your hands under the baby's armpits and turn the baby from their back to their side. Then pick up the baby side first into your lap. Similarly, lower the baby side first on the surface and then turn them back on their back. A baby enjoys versatile handling and experiencing different positions. This supports the baby's motor development, and switching between different holding positions is also easier for the adult's shoulders. Next, we will go over 4 different holding positions. Holding a baby on your shoulder so that their arms dangle over your shoulder encourages the baby to hold their head up and look at their hands. You can also hold the baby with their back against your stomach so that the baby is sideways in your lap. This position gently stretches the baby's neck and strengthens their head and upper body muscles. Place your arm under the baby's armpit and hold the baby's upper thigh. Both of the baby's arms are above your arm, allowing the baby to practice bringing their hands to the midline, which is important, for example, when learning how to grasp. Your baby should start spending time on their stomach early on. Lying on their stomach helps the baby learn how to hold their head up, shift their body weight, and use their arms for support. These skills will also help the baby learn how to crawl. The belly hold is a good way to let the baby practice being on their stomach. especially if the baby is not comfortable on their belly on the floor. In the belly hold, place your arm between the baby's legs so that your hand is underneath their stomach. Support the baby's chest with your other arm. The baby is free to move their hands, which will help them to discover their midline. Making a baby sit upright too early may slow down the development of other mobility skills and delay the baby's motor development. However, you can hold a small baby in a sitting position in your lap. Let the baby's back remain in a rounded position. In this forward-facing position, the baby experiences being upright. Place your hand under the baby's bottom so that their hips and knees are bent. Place your other hand under the baby's armpit to support their position. You do not need to support the baby's head, as the baby can lean into your body. When the child is alert, they enjoy spending time and interacting with their parents. Pay a lot of attention to eye contact with your baby. Chat with them and make facial expressions. Stroke, massage, caress, and squeeze your baby. By that way, the child gets to know their body. You can speak to the child in their own cooing, squealing language. You are speaking the same language as your child, and they get excited to speak more. It's good to start practicing tummy time as early as possible, for example by holding the baby in your lap. Tummy time helps to develop head and upper limb strength and shifting of body weight. These skills will also help the baby learn how to crawl. Tummy time is not recommended on a soft surface because it may cause breathing difficulties. The child learns to tolerate the pressure on the stomach. Movement is also developed from the position as the child supports themselves with their hands, does clockwise rotations, crawls, and so on. In addition, head and neck strength improve during tummy time. If the baby does not enjoy tummy time, you can start with holding baby in your lap, on the legs, or against your chest while leaning back yourself. Crawling is one of the most important and anticipated movements. As the head is held upright during crawling, the visual area in the brain develops. The awareness of upper limbs improves, assisting with fine motor skills later on. The hip joint becomes stronger with the development of edges in the hip joint socket. The back and abdominal muscles also strengthen. Alternating movement of limbs improves, which is needed later on for walking, skiing, cycling, and dancing. Research has found correlations between the lack of crawling and reading difficulties. It's easier for children to learn the most challenging skills while crawling first. Crawling can be done for an extended period, and crawling play can continue even after baby has learned to walk. A child does not need a walker, jumper, a chair that aids in sitting, or other special equipment for motor skill development. Instead, arrange the home so that the child can crawl, climb, rise against, and move along supporting surfaces. Good toys are those that motivate a child to move. Sometimes ordinary household items are enough, but also consider balls, toddler carts, and flashing or noise-making toys, which allow the child to practice different grips, seek solutions, and experience various sensations. It is worth considering whether various aids such as baby bouncers, bumper chairs, jumpers, or walkers are really necessary. Their excessive use may delay the child's initiation of movement. The child can practice taking steps by pushing a cart or a chair. Bouncing supports the development of positional awareness. But for a child who already walks independently and walks on tiptoes, or a child with unusually high muscle tone, a jumper or bouncing typically increases extension.